It's 24 minutes to 2 o'clock. It's time now for Business News on the Midday View with my colleague Devin Murugan, who's joining us now. Devin, good afternoon. So the results out from Clicks today. I mean, in the past, Clicks has been in the news for the wrong reasons, but Clicks is got a pharmaceutical as well, supply chain and value chain. And interestingly, there'll be a party to the COVID-19 vaccination rollout. Or they've got ideas about it, how to support government.
Yeah, very much involved, Brad, and you're quite right. We'll speak to the CEO in a second, but let's start exactly there. Clicks' interim profits have risen almost 10%. That's thanks largely to the demand for preventative medicines. The pharmaceutical, beauty and health retailer also saying its results were boosted by new private hospital business. Clicks is pushing ahead with expansions. It's scheduled to open 40 new stores and 36 pharmacies, while 40 stores will be refurbished. Well, let's get more insight now from a Clicks Group CEO, Vikesh Ramsunder. Vikesh, thanks very much indeed for talking to us this afternoon. So the big driver behind the good results, you say, were consumers buying so-called preventative medication. What were they actually buying that boosted these results?
So they were certainly buying a lot of nutraceuticals, multivitamins as well. And of course, hand sanitizers, in terms of prevention and healthcare support. So certainly the category was a big driver of our growth. And not forgetting, of course, people working from home. We sold a lot of cookware and electrical appliances.
It's also very interesting that you've seen an uptick in your beauty products section, at a time when outings are pretty much subdued and masks are still the order of the day. How did you read that?
So beauty in terms of color cosmetics and fragrances were muted, exactly as you said, Devin. Going out has been restricted, ladies are using masks, etc. But it creates some other challenges. So skincare was quite an important driver of growth for us in beauty. And, derma skincare grew almost 11%. So although we didn't sell color cosmetics and fragrances, we sold skincare.
Vikesh, let's just chat very quickly now about your role in the vaccination program. 600 pharmacies, 192 clinics across the country to support the program. You're obviously still waiting for details on the arrival of those tranches of vaccines. But what's at the center of preparation at the moment?
So we obviously started by making sure that all our pharmacies had the capability to vaccinate. So we had to train our pharmacists. We had to make sure that we could dedicate a particular area within the store for patients or customers to receive their vaccination. And of course, a post-vaccination review area as well. So it is really preparing so that consumers or individuals in the population can walk through our stores, receive a vaccination, have a period of about 15 minutes review to ensure that there's no adverse reactions, and then depart the store. So that's taken some preparation. It's taken some capital investment to ensure that we have appropriate areas set up in terms of privacy, etc. And really, it's waiting for more information from government so we can support their rollout.
Now, how many of your stores are actually registered? Because I think that's a very important point when it comes to executing this exercise, isn't it?
That's 100% correct. So at the moment, we have 62 stores that the government has registered, and that would be used as part of phase one, which are the healthcare workers. We are providing all our pharmacies and clinics to government to support the program, and it will be dependent on what government requires. So, by the way, we're very happy to be part of the program. I'm confident that there will be so many other service providers, and actually, quite frankly, it doesn't matter if all our pharmacies are included or not. We want to make sure that we can offer our services, because the more people we vaccinate and the quicker we do that, the better for all South Africans.
What's the status with your staff, and particularly nurses, who obviously need to be trained for this vaccination rollout?
So nurses typically by their training are able to provide vaccination. So the nurses aren't the challenge. The challenge, of course, is in the pharmacies where you don't have clinics. So that time has been spent over the last 4 months making sure that our pharmacists are equipped to also provide the vaccinations. Now, pharmacists typically do this once a year when we provide the flu vaccination. We've had to ensure that they have the capability and they are competent to provide the COVID-19 vaccine as well.
Just finally, before I let you go, I mean, you've let go of Musica, you've closed that down. I'm just wondering, and this is the first results presentation after that closure, how has the closing down of Musica affected your results?
Well, it's been quite a drag on the first half results. You know, if you excluded Musica, diluted headline earnings per share would have grown over 14%. So Musica has actually moderated our diluted HEPS growth to 9.5%. And you would have seen the loss that Musica made within the first half. We expect a slightly lower loss in the second half, and that business will be closed by the end of May. But what's encouraging, Devin, is that we managed to, maintain and retain almost 100% of the employees within the growing Clicks chain. And that's actually, we're quite proud of that.
All right, we're going to have to leave it there. Thanks very much indeed, CEO Vikesh Ramsunder, the CEO or leader of Clicks there, Braden.
I guess if you're a shareholder of Clicks, you think those are satisfactory results, and you might be forgiven to think very much bullish about the future. How